Hello, I'm Dr. Arunima, consultant dermatologist, Narayana Hospital, Tagore Hospital, Mukundapur. And today we have with us Dr. Sabyasachi Basu, consultant plastic surgeon, Narayana Hospital, Tagore Hospital, Mukundapur.
So, Dr. Arunima, today we are here to speak about the anti-aging therapies in the face.
Yes.
So, from a dermatologist point of view, I would like to ask that what are the different therapies that we can do for anti-aging in the face?
So, I think what we can do is we'll broadly divide, when we're looking at anti-aging, we have to target multiple things in the face, and we can broadly divide the treatment options into non-invasive and invasive. When it comes to non-invasive, we have both topicals and we have some orals also, but primarily topicals and laser light therapy or energy therapies. So when it comes to topicals, obviously as most people know, the primary agent that we use is retinoids. So that is one of the primary agents for anti-aging therapy. But since aging is a complex mechanism and there are multiple facets involved, we do need other kinds of therapy, including energy-based devices like lasers and also invasive procedures.
So, with aging, we tend to see that we have a lot, people tend to get wrinkles by the age of say 35, 40, 45, they get wrinkles. So, we know that Botox helps in treating wrinkles. Madam, if you are doing Botox therapy for wrinkles, how good is this Botox therapy and how long does it stay?
So, wrinkles, we have both static and dynamic wrinkles. Dynamic wrinkles are seen on the face primarily due to the muscle movement of the underlying muscles. So, when it comes to Botox or botulinum toxin therapy, what we do is we use this injectable to find out the wrinkles overlying the muscle by injecting the medicine into the muscle. These treatments are very relatively painless, very low downtime, and the effect will last depending on the amount used and the size of the muscle. The effect may last up to 9 to 12 months.
Okay, so that is wrinkles. Now, if we get the next part, what we see is generally with age, the face tends to sag down. When the face tends to sag down, there is loss of fat within the compartments of the face and the skin comes down, giving a lot of hollowness. So, we do fillers there. So, when we put a fillers are hyaluronic acid injections. I think fillers help us in creating a fullness in the face. So, what are your opinions about fillers?
Yes. So the thing is, when you look at, when you're saying anti-aging, what we are trying to do is we are going to replicate the features of a youthful face. And as Sir said, the features of a youthful face are primarily the fullness of the face, the lack of sagginess, the tired looking appearance that basically gives the illusion of aging. So to overcome these, we have fillers. Now, depending on the density of the hyaluronic acid, the cross-linking and the material, we use fillers at different levels of deposition. So while we have very deep fillers that are used for a little bit of remodeling, then there are little more superficial fillers. Then we also have very superficial hyaluronic acid intradermal injections called skin boosters. So depending on the indication, how the patient presents to us, at what age and at what kind of facial structure, we decide what kind of fillers to give.
So, surgically, if we look at it, there are some surgical options as well. So, if we look at the surgical options, see, one is you go for a major surgery, that is called a facelift, where you go put in incisions around the hairline, the invisible incisions, of course, and then the suture goes in and pulls the tissues up. So, it gives you a youthful look. They say that a young face is heart-shaped, while an old face is egg-shaped. So, to counter that, facelift is an option. But then there are non-surgical facelifts as well that we use by doing threads. So, threads do the same thing, but threads, there is a time limit to it. Say threads work for 6 months, 1 year, maybe 2 years max. But then facelifts, when they are done surgically, mostly they are for a very long time. So if we are not thinking about surgery, there are other options as well. Just like Dr. Ray said that there are lasers. There's this called HIFU. HIFU machine, they tighten the skin, they pull up the skin, and all this sagginess, the fall of the skin, the rounded face, that tends to be corrected. So if we move on to the next important topic of the day, it is about psoriasis. Now, psoriasis is a dermatological condition. And how frequently do we see psoriasis in the general population, and how do you deal with them?
Psoriasis is actually very common and also often misdiagnosed. So what happens is we see patients who actually have very prominent psoriasis, they are being misdiagnosed or treated for something else entirely, or people with long-standing seborrheic dermatitis or other inflammatory conditions being labeled as psoriasis patients. Psoriasis, how often we do see is, I think almost every day, 2 to 3 patients of psoriasis will be there in the OPD. So maybe 20 to 30% or more than that would be psoriasis patients. And then psoriasis has a seasonal flare. So especially in the winter, there is a spike in the presentation of psoriasis cases. How we treat psoriasis depends on multiple factors. The first and foremost, what we do is it depends on the body surface area. Now, if a patient presents with very localized psoriasis or psoriasis which is restricted only to the scalp, only to the nail, or there are only limited number of patches on the body, we can always treat them topically. But topically means on the basis of creams, ointments, or even intralesional injections. But say a person having psoriasis only over the palms, but it's affecting his daily life a lot. He's not able to walk or do any kind of work. He's not able to present his hands to anyone. So that is when we would start them on oral medications. Other than oral medications, there is also, depending on the patient profile, what kind of comorbidities does the patient have? What have they already been treated with? What is the kind of response rate they have had to previous treatment? We will modify the treatment. There are other kinds of treatment in psoriasis. One is phototherapy treatment that is also very helpful. The only con being that the patient has to frequently visit a phototherapy center. Also, we have biologics in psoriasis. So whether that is adalimumab, secukinumab, ixekizumab. So there are multiple treatment options in psoriasis.
And one other thing that is very frequently seen is vitiligo. So vitiligo is a very common problem in our society. Now, as a dermatologist, how do you treat vitiligo?
Since vitiligo is a primarily autoimmune condition where the body's own cells that generate the melanin or the pigment of the skin, they are getting attacked. So the patient presents with whitish patches. So the first and foremost thing that we do when we see a patient of vitiligo is assess the activity of vitiligo. Now, if the patient is having an active vitiligo, there is appearance of new patches or the previous patches are growing in size, our priority becomes to stop the autoimmune reaction. So accordingly, we'll have to put the patient on immunosuppressant medication and we address that. So once that is an unstable vitiligo or active vitiligo or progressive vitiligo. Now, if a patient has stable vitiligo, there is a different surgical approach. So can you tell us about that?
So what we do is we take a skin graft. So a skin graft is harvested. It's a surgery. So first we have to, as she said, that we have to notice that it is not progressing anymore, because if it is progressing, then the treatment will not be very useful. So we take a skin graft from your thigh or from your hidden areas, and then we put it on a compound called trypsin, and then we just clean it and then we apply it. So the melanin gets actually deposited on the areas where there is loss of melanin. It gives a very good surgical result to the vitiligo patients. So with that, we come to the end of this discussion. Thank you, Dr. Arunima Rai.
Thank you.
Thank you.